Hello, my name is Lovely from Respiratory Therapy, and today we'll be doing a mucus clearing adjuncts. And I'm going to go ahead and verify the doctor's order, and I'm going to go ahead and also verify the patient's order as well, and the hospital protocols for this specific device that we're going to be using today. I went ahead and reviewed the patient's chart, gather my equipment. So I'm going to go ahead and walk into the room. Hello, Lovely from Respiratory Therapy. Put sanitizer on my hands for 15 seconds and let it air dry. Apply my gloves on and grab the patient's chart, of course, so I can verify it again. Hello, my name is Lovely. Do you mind if I verify your name and your date of birth, please? Alrighty, it's Bubbles Cherry. Alright, Mr. Cherry. Alrighty, what's your date of birth? Alright, thank you so much. Oh, nice and 50. Alright, thank you. Alright, so I verified the patient's first and last name and date of birth as well, and verified it with my chart as well. And also let them know what department I was from, and also everything else that they needed to know. So I'm going to go ahead and explain the purpose of this procedure, of this device. The purpose of this device is to mobilize secretions and also reduce air trapping in asthma patients and also COPD patients as well, and also to help prevent atelectasis. So there are some risks that may come with that comes with this device as well. Also, if you start feeling lightheaded or anything like that, or lightheaded, if you start feeling nausea, just stop doing it. And also, there are some precautions we want you to take. Do it slow, take your time, and just take moderate deep breaths, nothing too crazy. So then from there on, I'll make sure the family and friends, if there were any in the room, and the patient, of course, understands. And if they had any questions before or after, we'll go ahead and answer those questions as well. So my device is already assembled because I put it together before I walked in the room. All right, so I'm going to go ahead and instruct it to the patient how to use the device. Mr. Cherry, you're going to go ahead and take moderately deep breaths and exhale actively against the resistor that you are going to fill in this device. Also is to perform is to perform 10 to 20 breaths per hour, and also repeat but do not exceed 20 minutes. So then from there, you're going to be performing some 2 to 3 half cuffs in between, which is just pretty much taking moderate deep breaths with longer expiratory times. Because if we're using our IE ratio, it's from 1 to 3 to 1 to 4. So from there, we're going to go ahead and explain that to the patient and why he needs to take his deep breath and longer expiratory breath, breathing out. So then from there, I'm gonna go ahead and assess the patient before he does the actual test. We're going to do a pre and a after post assessment. I'll go ahead and listen to his breath sounds, pulse, respiratory rate, and heart rate. I'll be doing the respiratory rate for 1 minute and the heart rate for 1 minute. In the back as well. Side. All right. Some wheezing over there, but hopefully that'll take care of it. Listen to his pulse while I'm doing his respiratory rate as well. All right. A minute later, if this device were to if this patient needed to do this device with a bronchodilator therapy, we would go ahead and place one in it as well. So how you put this in is you place the nebulizer in line between you place it between the mouthpiece. It's going to be this mouthpiece right here. You place it between the mouthpiece and the one-way inlet valve. And then that way you would go ahead and give them both. The patient will be getting both at the same time. But since the doctor did not order it and this particular patient does not need it, so we won't be doing it today. And then from there, I'll go ahead and give you a little background on the flutter valve as well. The flutter valve is kind of similar to this acapella as well. For the flutter valve, which is a variable orifice resistor, and we already follow the same procedure. You assemble your equipment, put them all together, and then you instruct the patient how to use it. The instructions are a little bit different than the acapella. So for this flutter valve, you're gonna tell the patient to tilt their head back slightly upward, and then you're gonna keep the airway open, and then you're gonna take a moderately deep breath and exhale actively against the flutter valve resistance without puffing up your cheeks to making a blowing pressure out of it. So you're gonna angle the device to the max that you can, of course, and then the flutter sensation is gonna do its thing. So then you're gonna go ahead and repeat it for 5 to 10 breaths and followed by a huff cough as well, just like you did for the acapella. So then the duration time for it, the sensation time for it, the session time for it is normally 5 to 15 minutes, and you do not need to exceed no more than 20. So from there, you're all set. So the difference between the flutter valve and the acapella, so we know that the flutter valve is expiratory pressure depends on the expiratory flow of the patient. And then the property, um, sorry, the proper technique for this one is needed to maintain the pressure flow of 10 to 20 centimeters of mercury. And as to where the acapella, put that down so we don't get confused. The acapella is a pressure generated by the threshold resistor. So it's pressure generated by the threshold resistor, and it's not patient dependent. We can set up specific pressure for this one. For example, 10 if you wanted 10, or if you wanted 15, you can set it. Compared to this one, you can't really set it because it's patient dependent. So those are the differences between these two things right here. So back to our patient. Now that he's done with his with his acapella treatment, we're gonna go ahead and do a reassessment again. Listen to his breath sounds, check his respiratory rate, check his heart rate, make sure everything is normal and back to normal. And if he was on any oxygen or anything like that, you want to put those things back to where they were, put his nasal cannula back on and his needle flow back on. So then you would document all of that on your and the patient's chart, and how the patient responded to the therapy, what his breath sound sounded like before and after. And then from there, you would go ahead and remove your gloves. I'll go ahead and physically remove my gloves. Remove your gloves and throw them in the trash, and then you'll go ahead and sanitize. And on other note, we'll go ahead and go over our contraindications. So for our contraindications, there, like I mentioned before to the patient, there might be some nausea or some vomiting, which is what we would not use it for if he was vomiting. Also, if your ICP, intracranial pressure, is 20 or greater, you don't want to do it. Inability to tolerate it, and or if it's increasing your work of breathing, and also if the patient had untreated pneumothorax, then we would not be letting him use this device either. But other than that, that's it. Thank you.